There are so many surgical options for pilonidal sinuses. Now, if one were to ask their surgeon, why do you have so many options for one particular condition? All what it means is most of these surgical options do have a failure rate, and that is the honest truth. There are two main types of operations for pilonidal sinuses, broadly. Some of them are open operations, some of them are keyhole operations. I'll start with the open options because they were the first to be introduced. These operations are named after different surgeons who introduced these surgical options when they first started. The classic open pilonidal sinus operation, the very first one to be described was the Karidakis operation. Karidakis is a Greek surgeon who introduced this operation. Karidakis is good for pilonidal sinuses which are off midline from the nasal cleft. Whereas if your pilonidal sinus activity is confined to the midline, a Bascom's operation could be an option. There are two types of Bascom's operation called type 1 and type 2. I'm not going to bore you with those details, but essentially these are for midline pits. Then there's another surgical option called marsupialization. What it means is that the pilonidal sinus will be open and the inside of the pilonidal sinus cavity will be sutured to the skin and left it to heal on its own. We call it healing by secondary intention. Then there are so many other ways of excise and closing the pilonidal sinuses. Some of them are just simple excision and closures, and some involve fancy plastic flaps. In very worst case scenarios, when you cannot close it after excision, then of course the wound will be left open to heal by again secondary intention. Those are the open options for pilonidal sinuses. But when it comes to keyhole option, the option is what is called an EPSIT. EPSIT stands for endoscopic pilonidal sinus treatment. Here, of course, the surgeon will be going through the existing hole with a miniature camera to clean it and treat it from inside without the patient having to have any more incisions. The advantage of that, of course, is even if it fails, because the surgeon hasn't given any more incisions or scars, then of course we could always repeat that. But lastly, if a patient develops an acute abscess, then of course the option is what is called an incision and a drainage, which is just to let out the pus so that the antibiotics can work. And of course, in such situations, the patient will subsequently need a definitive procedure later on. I think the most important thing is to have a discussion with your surgeon as to what is the best option for your configuration of pilonidal sinus activity. This depends on the procedures that you had in the past, the configuration of pilonidal sinus activity at your nasal cleft. Is it midline or is it lateral or is it both? Have you had any previous recurrences? And also about your body habitus as well. You should discuss with your surgeon about the chance of a recurrence. No, you should accept and understand that most of the surgical options have a higher chance of recurrence. The chance of recurrence for an EPSIT procedure is best out of all those, and that is about 30%. But some of the other procedures, the recurrence rate could range from 30 to 50%. You should always try and keep the area hair free. Now that is from top of your shoulders to the bottom of your bottom buttock crease. Now you could use depilating creams or laser or shaving or any means. However, although it will try and reduce the chance of you having a recurrence, or if you do have a recurrence, the chance of severe inflammation, it doesn't guarantee you not having another recurrence. Essentially, the reason is the hair could be falling from head. But it's a kind of a desperate attempt to avoid a recurrence, really. And of course, if you do have an acute infection, then you will also benefit with some antibiotics. And if you do have pain, you will then need some pain relief until your operation. The operation will take about 30 to 40 minutes, and these are performed under general anesthesia. That is, you will be fully under asleep. As such, you need to be accompanied by someone home, and an adult need to be there with you for 24 hours. The operation is performed as a day case procedure, as I said, so that means you'll be going home on the same day. For all types of pilonidal surgery, of course, one need to take regular pain relief depending on the procedure that you had. Now, if you had an excisional operation, of course, it will be more painful. So you need to have pain relief at least for about 4 to 5 days. But whereas if you had an EPSIT procedure, then the pain, the chance of you having pain is low. So you might end up having needing pain relief for about 3-4 days. Then, of course, if most of the time you will be discharged home with some antibiotics, which will be helpful. And I said before, you need to keep whole of your back from shoulder downwards up to the bottom buttock crease hair free. We always advise patients to wipe their back after opening their bowels forwards rather than backwards to prevent poo going towards the wound side. So that's another thing that you could do. You should always keep the area dry and clean and dry. So a shower every day and then pat dry it and put a dressing would be helpful. Now, when it comes to excision and excisional operation, and in particular if the wound was kept open, then of course you will need dressings through your medical professionals, maybe every other day to start with, and then it will be stretched apart until the wound heals. Now, if you did have a closure operation, meaning excision and some kind of a stitching, either a Caridakis or a Bascom's or a simple excision closure or a flap repair, then of course you need to keep the area clean and dry until the wound heals. We don't want any infections around there. That's not the best place to have an operation. And also, please do avoid any stretching of that area for about 2 weeks. Now, when I say stretching, that involves cycling, horse riding, gym exercises, anything that kind of stretches that area, because the wound is under tension and any more tension can gape it open. And if you do have if you do end up with an open wound around that area, it's quite a difficult thing to heal. And I normally, as such, ask patients not to do any stretching exercises for about 2 weeks, plus another week after suture removal, just to make sure. Then, of course, sutures need to come out at day 14. Now, if you did have an EPSIT procedure, then of course the wound need to be syringed with saline syringes. In my practice, I normally give them the saline syringes as well as saline vials. The saline syringes do have a nozzle. The nozzle need to go into the wound, and then a little bit of saline need to be skirted in, and then the syringe can be taken out. This need to be done in the morning after going to the toilet and cleaning, and also at bedtime. So twice a day for 10 days. It's part of the treatment. It's very essential that you do this at home. Of course, you won't be able to do it yourself because you just can't see. So someone in your household will have to do that. Now, you should expect a discharge for about 6 to 8 weeks. So we normally advise some cheap absorptive pads to be applied over the wound so that your underpants are not wet. And then, of course, in any of these surgical procedures, you should expect an outpatient review. Typically, it's around 3 months. So those are the things that you should do after pilonidal sinus surgery. I think the main issue of any pilonidal sinus surgery is the high chance of recurrence. Now, it's about 30%, as I said, for EPSIT procedure. But if you had an excision and a closure, it could range from about 30 to 50%. So that is the biggest issue of any kind of a pilonidal sinus surgery. Now, if you did have an excision and a closure, Another issue that you are at risk is gaping opening of the wound. So that is why we do ask patients not to do any stretching exercises for about 2 to 3 weeks. Then, of course, if you had an open wound, meaning if it was excised but not closed, then, of course, an unhealed wound, which will be there for a few weeks, is a problem. In any case, the wound infection is an issue because it's very close to the anus, and that is why we ask the wound to be kept clean and dry. We give antibiotics, and also we ask not to wipe backwards but forwards. And finally, of course, if you do have a recurrence, then you will end up needing other procedures. Now, these procedures are performed after or rather planned after the 3rd month review, depending on your situation. Now, the reason for the 3 months review is most of these procedures, in particular the EPSIT, will take about 3 months to heal, and we need that time to come to a decision whether this has recurred and to see whether you need any procedures. There is an article on my website about EPSIT and pilonidal sinuses, which will be very helpful if you do have time to read.